So we have two talks for the next hour. We're going to start with Jacob Zelko. He is the Chief of Global Health Informatics at the OneFact Foundation and is also an incoming graduate student at Northeastern University. Jacob, take it away.
Awesome. Thank you so much. Thank you so much, everyone. It's a pleasure to be here. I hope everyone's JuliaCon has been going great so far. Welcome to my talk, 100 Million Patients, Julia for International Health Studies. My name is Jacob Zelko, and I'm also the Cedar Prince. So a little bit about my background, just to give some context. My involvement with the Julia community is pretty heavy as the co-head of the JuliaHealth organization currently, chair of some community outreach development funds within the Julia community, and a couple other affiliations within Julia. Furthermore, thank you so much for Julian's introduction, I am the Chief of Global Health Informatics at the OneFact Foundation, dedicated to health transparency in the hospital systems, and also pursuing applied mathematics at Northeastern University. So, to give some context to this talk and to supply some necessary background, the first thing I need to do is actually talk a little bit about another organization outside of the Julia community called Odyssey. And Odyssey is the Observational Health, Data Sciences, and Informatics Open Science Collective. As that's a mouthful, we just call it Odyssey. But they are dedicated to the study of observational health research. And observational health is looking at an analysis of real-world data such as medical claims, electronic health records, health information exchanges, so on and so forth. And they've developed open community data standards to work with this data in a modular as well as standardized way called the OMOP Common Data Model, which I will get back to in a little bit. Additionally, they focus on translating this real-world evidence or data into real-world evidence. And collectively, the ecosystem within Odyssey of all the collaborators represents nearly 1 billion patients across the entire globe. To give a sense of where all the collaborators are, the blue dots represent collaborators located throughout all the countries of the globe. So I can see it's quite an extensive network. And moving forward, one of the chief innovations that has come out of the Odyssey community is this thing that I mentioned earlier. It's actually the Observational Medical Outcomes Partnership Common Data Model, and that is a horrible name, so we just call it the OMOP CDM. But in essence, what this actually is a data standard that we prescribe to databases that utilize or ingest clinical claims information, electronic health records, and this is a schema that represents all the different tables of how this data gets ingested. So we start with actually a person table. We can develop things such as derived tables like location, cost, so on and so forth. So it's quite extensive, and if anyone's familiar with the healthcare, it has to accommodate the mess that is not only the U.S. healthcare system, but maybe just in general. Now, moving forward, talking a little bit about ecosystems. Within the Odyssey ecosystem, there is something known as the Hades suite, which is a collection of different tools developed to work with OMOP CDM databases. And these are tools based in R and Java. I threw up these squares up here, not to really show the names of all the packages, but just to give a sense of all these squares represent different packages within the Odyssey community built around the OMOP CDM. So as you can see, it's quite extensive. Unfortunately, there is some barrier to entry with developing in this ecosystem as there's a mixture between different languages, which we have a language that might solve this problem of mixing languages together, as well as lack of documentation and some other problems that I've personally run into both as a Julia and R developer. Before I go further with this presentation, one piece of software that I do want to highlight from the Odyssey community, let me pull it up in just a second. Let me see here if this will work. Perfect. And then let me go ahead and pull this up, is a tool known as Atlas. Atlas is a tool in the Odyssey community that is designed specifically for defining and developing patient definitions or patient cohort definitions, where if someone's looking for a patient population with specific criteria of diseases or outcomes or whatever sorts of events that they're looking for, they use this tool, which is a shiny application in the R ecosystem. Now, I will explain why I'm highlighting this in a little bit, but this is actually a disease definition for patient populations who have type 2 diabetes. And actually, if we go over here, we can actually see that there is a variety of what are known as clinical concept codes mapped to standardized clinical ontologies such as SNOMED, ICD, all related to diabetes. So going back to the presentation, and I'll come back to Atlas in just a minute, so just hold that in your head for a moment. is I want to give some background on what I'm doing within the Julia, and specifically the JuliaHealth community. So I'm currently the principal investigator for a international collaborative network study that is to design a package or develop a package to characterize populations with mental health conditions, investigate prevalence of mental health care, and utilization of mental health resources in rural and urban communities. For the sake of the presentation today, I'm actually going to focus only on these two targets. Target 1, identify vulnerable populations and their characteristics. And target 3, conduct large-scale observational health research. And also, circling back to the bolded developed package. Now, what does that mean? So in the Odyssey parlance or vocabulary, there's a bit of conflation of terms. And when we think of package, we think of data frames, we think of SciML, we think of all these different tools. But in the Odyssey sense, a package is actually known as a network package, which is a collection of scripts and sort of instructions that we disseminate through the Odyssey network. That then partners at all these different sites that have these patient databases in the OMOP CDM will be able to run this package on their data and report back aggregate statistics to collaborators in such a way that is safe, secure, and respects patient privacy. And to that extent, when I talk about vulnerable populations on a large scale, is this notion of what is a network. In the Odyssey sense, the network is actually all those collaborators that you saw, all those blue dots on the map earlier. So that's what I mean by collaborators, on a large scale. And then just to clarify, when I say chronic mental illnesses as well, I'm also looking at bipolar disorder, depression, and suicidality. So what's the progress of that study so far? So as you can see, here's a sample of some of my collaborators from multiple different countries, such as Spain, South Korea, and various parts of the United States. Green represents that step is completed, blue represents that step is in progress, black represents that step is yet to be done. And collectively, we have a patient patient cohort of around 100 million patients in this study so far, which is pretty exciting. So now you might be wondering, okay, so that's great, Jacob, but where does Julia come into this? This is JuliaCon after all. So with that being said, let's get to some exciting demos showing how we've been using Julia in this context. So give me just a moment to pull up these demos. We're going to try doing this live, so we shall see how well this works out. Here we go. And then let me just make sure I have everything set up here. Oh. Okay. It would appear. There we go. And here we are. So let me just make this a little bit bigger. Great. So this is our first demo focused on patient characterization. The concept of patient characterization, I'll get into that in a little bit, but in the context of this demonstration, we'll be using 4 different JuliaHealth developed packages to analyze the data stored in the OMOP Common Data Model. This is OMOP CDM Cohort Creator, which is to create cohorts or patient cohorts, like I mentioned earlier, from databases utilizing the OMOP CDM. Health sample data, which is another JuliaHealth resource for providing synthetic patient data that we can use for our analyses, as well as DB Connector, which is a DB interface-based tool to connect to multiple different databases of different SQL flavors. And finally, Odyssey API, which allows us to query or pull cohort definitions from tools such as Atlas. So going through this, I'm going to, for sake of time, since we started a little later, more so just kind of highlight how this code works. The outputs are recorded here. If there's any questions on how the code runs, I'm happy to answer that. And let me zoom in. Does this look appropriate? Can everyone see that? Fine? Okay, great. So the first step with this demonstration is that we can easily pull synthetic patient data from the JuliaHealth ecosystem now. Here we use a tool called Health Sample Data, which I mentioned earlier, and we import this function Eunomia. Eunomia is actually a synthetic data set that anyone can install or download onto their computer from JuliaHealth Sample Data. That is a SQLite database that is formatted in the OMOP CDM with actual synthetic patient data. So if you want to play around with that ever, just to see what an OMOP CDM database looks like, Eunomia is your tool. Now, going next from here, we can use DB connectors to set up a connection to Eunomia itself. And as you can see, DB connection actually abstracts some of the nice DB interface tooling that we've built within the Julia data ecosystem. And here we can specify the SQL flavor that we're using, SQLite, and the database path to our SQLite file in this situation. Now, there is a little bit of boilerplate that will hopefully be worked out in the future, but as you can see, we generate some internal database details such as the schema's name, the SQL dialect, and then we also generate internal representations of the tables within the schema of this Eunomia database. The reason why we do that is just because some sites across the globe do not adhere strictly to the OMOP CDM standard, which is so tragic. And so this gives people the ability to define their own tables as well. I'm not going to show that functionality today, but just so you're aware. And as a sanity check, we can go ahead and look for every single patient that's in the Eunomia database. And in this case, we're working with roughly 2,700 patients suffering from, well, 2,700 patients within this database. Now, for characterization, I mentioned earlier I'd explain what that is. So what characterization looks at is it looks at a group of patients across a variety of axes such as race, age, gender, so on and so forth, and combinations thereof. We're characterizing these patient groups by these axes. And this is a mini version of such a characterization study looking at individuals with a history of strep throat. And this is represented by the clinical concept ID of 28060 if you want to look that up sometime in the future. Now, using the tool OMOP CDM Cohort Creator, which is aliased by OCC, we can call the condition filter person IDs, which gets us everyone in the database that's ever had a condition of strep throat in the past. And then from there, we go through this iterative process of finding, every single patient's race, their gender, and their age group. Now, before we get to talking about age group, I do want to mention we have about 1,700 patients that we found within the Eunomia database, which is no surprise because strep throat is rather common. But then moving forward to the age groupings of patients with strep throat. So oftentimes, and especially observational health science, we want to know how patients get grouped up into their ages, be it custom groupings from maybe particular agencies in the United States, or how we might be comparing to another table or paper. And this gives us our own custom ability to actually define our own age groupings. So in this case, I'm grouping by increments of 0 to 5 up to 120 years old, which is a little funny because Eunomia has 120-year-olds in the database. So all that to say, one digression or one tangent that I do want to mention is the fact that every single function within OMOP CDM Cohort Creator is actually using this tool called FunSQL because, well, it makes working with SQL fun. And this was created by Clark Evans and Kirill Simonov. And as every single function is built on top of FunSQL, which is itself a domain-specific language within Julia, we can actually go back through the language and generate the raw SQL that is being used to generate our patient cohorts right from the particular database. So sitting here is the SQL for age grouping. Now, with that being said, we can go ahead and do our characterization of each person by gender, race, and age group. And for those curious, we're going to be using the combine, split, apply paradigm from the data frames ecosystem. Bogeymeal has been fantastic for popularizing that in the Julia ecosystem, but I think Hadley Wickham was the one who first developed it. So we end up being able to combine all of our different queries together, and we get a final data frame that shows person ID, race concept ID, gender concept ID, and age group. So great, we started that initial characterization. And now, just for an optional point that you don't have to do necessarily for your own analyses, you can if you want to. We can use Odyssey API, and this is, I apologize, rather admittedly garbage type code here because I was preparing this for the demonstration. You can very quickly actually go through and re-identify or remap all the concept IDs back to their human readable formats. Now we know, okay, that's what that number means. It means male, female, white, black, or African American. So going forward, we do this characterization, and now, just one second. Yes, okay. So now, as I mentioned earlier, we did our characterization across unique individual patients, but oftentimes we're very concerned about suppressing patient information or suppressing personal identifiers of patients. So our next step here, and I'm not going to get too much into this just because it's a little bit, kind of rote. It's data analysis. But what this is doing is stripping away all the person IDs from this data set and then aggregating based on the axes that we're examining counts for how many patients fall into each respective combination of race, genders, and age groups found in the data frame. So as you can see here, we ended up with counts of 21 for Black or African American females between the ages of 60 to 64 in this data set, and these again represent patients who also have had a history of strep throat. So going forward, let me just skip this for a moment. We can actually then easily take these counts that we've developed for strep throat populations and actually jump right into calculating population prevalence, which is a commonly used statistic to look quickly at databases. In particular, this is going to be a crude coarse prevalence statistic looking across the entire data frame. And we can go back through, look at all the different patients, and within the database, generate a numerator count, a total count, and then calculate a crude prevalence value for our statistic. And finally, we can also use suppression analysis using execute audit, which comes from OMOP CDM cohort creator. And these audits are in compliance with HIPAA or other sorts of tooling to make sure that if we're going to report data out to collaborators, this is safe to share. So with that being said, that demonstration is done. So let me go back to the main presentation. Give me just a moment. So with that characterization being said, we can go from a very complex sort of SQL representation. We can go through abstracted OMOP CDM cohort creator functions as well as composition with the rest of the Julia ecosystem. We can then, for sake of time, I wasn't able to cover this. We can then modularize these function calls very simply and finally get a final output that can be used for future analysis with individuals or collaborators in the future. And this is a low-level programmatic approach designed for those who can code and quickly deploy simple queries against a database. And now just one final demonstration. We'll be talking about cohort definitions. If you remember earlier, I introduced this package called Atlas. Now, Atlas is built in R. It uses JSON and all these representations. But say if someone comes from Odyssey into Julia, well, they don't want to leave all their work behind, right? And so this tooling actually allows someone to pull their own custom patient cohort expression from Atlas back into Julia so that way they can maintain their productivity within the Julia ecosystem. It uses the same JuliaHealth tools as well as some other Julia ecosystem packages. And just to go through this, we can activate our project and then pull a cohort expression from Atlas. This is actually our type 2 diabetes definition that I showed earlier, written in JSON format. Now, that looks pretty ugly, but thankfully, Clark Evans and Kirill Simonov also created Odyssey cohort expressions, which is a tool for taking in this JSON representation, defining it for a particular OMOP CDM version or schema, in this case, version 5.3.1. I'm not going to talk about versions in this tutorial, or this talk, but there are a couple different versions. We can designate the dialect to SQLite, and then generate the SQL code that would actually run and collect every single patient that we need for type 2 diabetes from our OMOP CDM database. Now, getting back to our talk here, give me just a moment. So the general remark on this is it gives us a way to be able to bridge between communities and ecosystems. As the Odyssey community and the greater OMOP CDM community uses R overall, this gives us the ability to go back between the two and actually bring their productivity and their tools over to us so that we can maintain optimal productivity and novel research directions. And this is also designed for those who might not be the most comfortable with coding, who've used Odyssey Atlas in the past, or have done a bunch of work in Odyssey with their tool stack in the past, and they want to bring their work over to us. Now, some reflections on the project so far, talking about Julia and its involvement with their overall process. Our largest deployment with JuliaHealth tools is at one of our partner sites that has nearly around 80 million patients right now. And we've been using some of the JuliaHealth tools to help with data management, processing and analysis, and the sharing of results drwatson.jl is a fantastic package which has been used to drive all of this sort of process. And as you can see with the overall workflows, we use, we pull in data extracts from all our different sites. We use data version control to maintain correct versioning of our data extracts being pulled from different locations across the globe. And we use the cloud to maintain, backups of everything. Then finally, when we get to processing analysis, we use Julia to process everything that we need to as these data extracts come in. We use a combination of Mach-E, literate programming ideas, and we use Quarto at the end to be able to generate usable, shareable PDFs that we send to collaborators across the globe. Now, with that being said, using Julia in production can be tricky. So these are just some of my general reflections on this idea is that international deployments of Julia are tricky, at least in my experience so far, in that everyone has different architectures, everyone has different deployment schemes, and most often OMOP CDM databases are stored within air-gapped or highly secure environments. And thankfully, though, through the course of this project, right now my colleagues and I have published one paper so far on developing a cohort or patient definition. But additionally, we're working on a paper about best practices with how we can make these deployments easier in production. And I will say, though, in my experience, that Julia deployments solve the versioning problem, especially when compared to the R ecosystem. This is very easy to deal with. And then also, the productivity is unparalleled within the Julia ecosystem, as evidenced by here, where I felt no lack of actual tools that I needed for my analyses. And now skipping ahead just a little bit in this slide deck, just for the sake of time, we'll go up here. I want to talk about next steps and the future of this work. So JuliaHealth is still a burgeoning and blossoming sort of subcommunity within the Julia ecosystem. I'm very excited to report that for the first time ever, we have our very first Google Summer of Code student for JuliaHealth. Her name is Frida Abdul Aziz, and she is working on patient-level prediction, which is looking at using tools like MLJ and some others in the ecosystem to be able to take retrospective patient populations within an OMOP CDM dataset, and then be able to predict potential patient outcomes. Finally, the open problems that we're looking at is type systems for composing clinical elements together, and also course treatment pathways for patients, shown in the diagram on the right, showing how different patients can receive different medications over their time receiving care for particular conditions. And also, this is a little call to action, but I think we can do network studies now within the Julia ecosystem. I think it's fully possible with the tooling that we've been developing within the JuliaHealth ecosystem. And through kind of the work and networking that I've been able to do is that there's a growing network of sites across the globe who are Odyssey as well as JuliaHealth friendly folks who are friendly to using Julia in their projects and analyses. And for me, I think this would be great to enable more people to participate across the globe. And to just end off with a final quote from Dr. Alan Edelman, from one of my favorite talks that he gave is, a programming language to heal the planet together is the quote, Julia is a programming language that lets humans talk to humans, creates a community that promotes social action, and a system where everybody can work together. And I think to put a JuliaHealth spin on it, I think Julia is a language that gives us the tools to drive fairness across all populations, support timely health policy interventions, and elevate the hidden figures behind all of our analyses. So thank you everyone so much for your time, and let me know if you have any questions.
Thank you very much, Jacob, for that wonderful talk. So we can take some questions now, if there are any.
Yeah, Jacob, thank you.
Yeah.
I had heard about DSI and Harris at a recent another conference on informatics. And when I was asking the person who was giving the talk whether they considered Julia, they said, no, we don't talk about Julia in that DSI. So I was very intrigued to see that all of this work going on.
Yeah.
So is there a possibility of a Julia fork for Hades or
For which?
for Hades?
Yeah.
If you don't mind repeating.
Yeah. So if I'm repeating the question correctly, so is there like a reproduction of Hades within the JuliaHealth ecosystem? So to some extent there is. Right now, the biggest problem that we face within JuliaHealth is the problem of composition, where packages within the Julia ecosystem compose very well together, and with the problems faced in JuliaHealth is not so much that we need to reinvent or develop new packages. It's more developing the novel compositions to solve the problems. Because I think we already have the tools in the ecosystem, as I showed during the presentation. But especially, like, for example, with my Google Summer of Code student right now, we're not really developing a new package per se. We're just developing a new approach using, for example, MLJ in this case. Does it help answer the question? Okay.
Yeah, kind of. And the other thing is, of course, with the eunomia, it's quite possible to create synthetic epidemiological studies. So we could create, say, for example, synthetic case control studies to investigate certain things. So
Yep.
what is eunomia basically based on? Is it based on synthetic patients or is it based on real people data? Or?
Yeah, so it's based, the group who makes it is a subgroup within Odyssey called Cynthia, and they use, my understanding of it is that they use some sort of statistical weighting module, like statistical weighting pattern to actually derive from patient data that they have access to and seed synthetic patient generation in the future. And I'm also hoping to maybe bring like a synthetic patient generator within the Julia ecosystem as well. Yeah.
Do we have any other questions? I have a question myself. What are the greatest challenges, or have you had challenges working between multiple languages, between Julia, R, Python? I know not everyone has had the best experience, but how has your experience been with these integrations?
Yeah, no, it's a very great question. So actually, with OMOP CDM Cohort Creator, which is the principal tool I was showing to develop cohort definitions and populations, it's actually been very effective in that we've actually developed a tutorial that if you look up that package right now on the general registry, we actually have a tutorial showing if you're coming from R, here's how to use Julia as a backend and just drive your analysis using all your comfortable R tools like dplyr, all those sort of tools, but you have all the functionality of Julia as your API. So you're still able to maintain the performance that you have in your language of comfort while also getting all the cool benefits that I was just talking about today.
Thank you. Let's have another round of applause for our speaker, Jacob.